بسم الله الرحمن الرحیم. دوستای عزیز، قسمی که قبلا ما شما گفته بودیم در مورد امتحان ملی امروز گپ میزنیم و امروز دوست بسیار خوب ما را از اکادمی آموزش‌های پروگرام ملی با خود داریم که با سوالای ما پاسخ میدن و امروز آقای علمکره همراه خود داریم که از هندوستان هستن و میخواین در این مورد بر ما معلومات بدن. Welcome Mr. Alankar.
Thank you so much, Dr. Jalal. It's my pleasure to have you here.
I'm also happy to have you. We will start with the question that first, what is USMLE?
Okay. So any student, any of the medical student across the globe who wants to practice in US as a doctor, right, will have to do residency in normal terms, will have to do their PG from the United States, right? The PG, we term it as your residency there, right? So you'll have to do your residency from the United States. In order to get into the residency, you'll have to go through a set of examination. That's what we call as USMLE, United States Medical Licensing Examination. Now, we have 3 steps in USMLE: step 1, step 2, and step 3. Okay, so step 1 and step 2 can be given from India itself or any other prometric center across the globe, which is a MCQ, like a MCQ examination. In step 1, now, like after 4 days, it is going to be pass and fail. So there will be 280 questions. 194 is the passing score. If you secure more than 194, you'll be declared as pass. If you secure less than 194, you'll be declared as fail. Okay. Right now, there's a scoring system, but after 4 days, it will be a like pass and fail system. And step 1 curriculum is your basic sciences. So if you have done your MBBS from India, so we can say that your first year and second year curriculum is what they ask in USMLE step 1. That means your basic sciences. If you talk about subjects like anatomy, physiology, pharmacology, behavioral science, pathology, and all, right? So there are 7 subjects.
Okay.
Now, then let's come to step 2 CK. It stands for clinical knowledge. So step 2 CK is again an MCQ examination and can be given from any of the prometric center across the globe. For in terms of Indian medical school, the curriculum is your 3rd year and 4th year syllabus. That means it's your mainly clinicals, right? So any Indian student who is into internship can write the step 2 CK examination. Okay, then once you are done with the step 1 and step 2, then you'll have to write OET examination, that is occupational English test. You'll have to write the examination, and then you can apply for ECFMG registration. There's also a pathway that is altogether different thing, but you can apply for ECFMG registration. ECFMG stands for Education Commission for Foreign Medical Graduates. So any student who wants to apply for residency in the United States should be ECFMG certified. Not even residency. If you even want to apply for fellowship in the United States, you'll have to be ECFMG certified, right? In order to get in ECFMG, right?
Okay.
In order to get into ECFMG, you will have to complete your step 1 and step 2 and OET exam.
First, you have to clear those exams.
Exactly.
اوکی. خب دوستای عزیز، اینا در مورد امتحان ملی قسم معلومات میگه که امتحان ملی یک امتحان است که کسایی که علاقه‌مندی به خاطر پرکتیس کردن یا کار کردن بخش طبی در امریکا داشته باشن، اونا ضرورت است که باید از امتحان ملی استپ اول و استپ دوم باید که پس شن یا از امتحانا کامیاب برن، که اینا میگن این امتحانای MCQ questions است، یعنی سوالای 4 جوابه می باشن و با 3 بخش اینا تشریح میکنن: step 1, step 2 and
OET.
OET,
Occupational English Test.
Okay, Occupational English Test. که step اول همو سوالات it will be clinical questions or basic sciences. و بخش اولش اینا میگن مؤسسات طبی را میگن. You will get passed from these 3 exams. After that, you will be able to
apply for residency. Once you will be ECFMG certified, then you will be able to apply for residency.
اوکی. خب اول باید برای ECFMG یا همون محصلین خارجی که میاند امریکا باید اول از اونها پس شوین. بعد از اون شما میتونین که با پروگرام رزیدنسی شما اپلای کنین.
Jalal,
Okay.
one more thing. I just like since we spoke one part is still left. That is step 3.
Okay, step 3
Okay.
is remaining.
Yes,
Okay.
I did not talk about step 3. So for
Okay.
step 3, there are two options. Okay, either you can write your step 3 before your residency or during your residency. So step 3 is not required to get into residency. Step 3, in very simple words, in a common man word, we can say it's a kind of licensing examination or a kind of exit examination.
Exactly.
Without clearing step 3, you will not be allowed to practice in the United States.
Okay. میگن امتحان استپ سوم داره که استپ سومش باید که شما هم انتخاب دارین که در جریان رزیدنسی تان میتونین اون را پس کنین یا هم میتونین که بعد از اون را پس کنین و بدون از او امکان نداره که شما پرکتیس کنین. Actually, I previously heard that the step 3 examination has been cancelled and this. So
no, it was not step 3, it was step 2 CS.
Okay.
So in step 2, we had two exams, step 2 CK and step 2 CS. CS was clinical skills. So CS has been removed due to this COVID situation and everything. They have permanently removed it. And instead of CS, we have OET examination.
OET examination. ما قبلا شنیده بودم که استپ سوم امتحان از بین رفته. اینا میگن که نخیر نه، استپ سوم از بین نرفته، فقط استپ سوم بخش کلینیکالش اونا دور ساختن ولی استپ سوم باقی است که اون باید که امتحانش پس کنین و بجای از او همون انگلیسی طبی را جایگزینش کردن. Okay, who is eligible for giving USMLE exam?
Okay, so any of the medical students, right, is eligible to write USMLE examination provided their medical school is listed with World Directory of Medical Schools, WDOMS. So any student, like for example, I am from XYZ college. Like just for example, maybe so you are from NIU, right? Noida International University.
Yeah.
If you want to apply for USMLE, you need to check. You need to go to WDOMS website. You need to check whether your school is there or not. Your med school is there or not. If it is there, if we have notes, ECFMG notes available, you are eligible to write the USMLE examination.
Okay. For that, we have to check a specific website.
Exactly.
Which is
World Directory. Can you just share my screen and show it to you?
Yes.
Or you can just type in wdoms.org.
Okay. You're on PC?
Yeah, I'm on PC itself.
Okay. Kindly, there will be a button like share your screen, maybe.
Yes. I'll just do it. Just give me a second. Oh, you have disabled my screen sharing.
Screen sharing. Okay, is it enabled now?
Just I can do it. Okay. So you can see my screen, right?
Yes.
Great. So I'll go to wdoms.org. Okay, here it is. I'll go on search. Just give me a second. Okay, great. Now I'll select country as in India. Med school, maybe Sharda is what I can type.
Yes.
Sharda unit. Just let's type Sharda. And I'll just solve. Additionally, yes. We need to have the exact name of the college. I don't know Sharda's now. Let's talk about Lady Harding. I can see Lady Harding, right? Can you see? Yes. So Lady Harding students are eligible. I'm not so sure about Sharda spelling what it is. So, for example, Maulana Azad, MAMC. I can see it. right? So on the same website, you'll just have to go and check about your med school. You might have to type the exact spelling and exact name. For example, there are lots of students from GMC, Government Medical College, right? So what I can do is I can just type Government Medical College. I will not type city over here. You can see lots of GMTs are there, right?
Yeah.
Similar name. You can type. We have like 5 pages. So
Okay.
this is the website where you have to go and search about your med school if you are eligible for it, right?
Okay. First, they have to go to this website. After that, they
Yes.
will be able to find it out or they eligible or not.
Exactly. Or they will have my contact number. If they want, they can easily call us and we'll search. Even if from like there are lots of students from different places of the world, like Kazakhstan, Russia. So we used to do it on their behalf. So that's not an issue.
Okay. We will mention all your contact details also with them. خب دوستان عزیز میگن که اگر شما میخواین که eligibility یا ای که شما آیا مستحق هستین که در این امتحان اشتراک کنین یا نه، باید به این خاطر داخل یک وبسایت شوین که وبسایت قبلا بر شما منشن کردن، اونجا عملا رفتن و کار کردن، بر شما نشان دادن که چه قسم میتونین سرچ کنین. Okay, the next question will be what documents are needed? What documents they need if suppose we searched their university name came there. After that, a process of registration will be there. What documents are needed?
So if your university name is there, I'll recommend you to start your preparation as soon as possible. Once you are done with your preparation, or you feel like, okay, I will be able to write my examination in next 3 to 4 months, you'll have to go on ECFMG website and you'll have to register yourself over there. So for that, first of all, you need your passport. Okay, your passport is mandatory. Then they'll ask for your college name and everything. And then you'll have to they'll contact your college for the letter. So your college will have to send a letter to ECFMG. They'll verify it, and then your medical transcript and everything is required, and then you can register for the examination and you can get the examination. So there's no as such any specific document that is required, at least for the examination. Only a college document. That's it. Okay.
That's it. So you have that specific website also that we have to register on that specific website.
Yes, ECFMG. Okay. Look, the ECFMG is a little trickier one, to be very honest. What we do is we offer free assistance to all our students who go for ECFMG, all our medical students with ECFMG registration. Okay. So this is what the website looks like, ecfmg.org. You'll have to go in there, you'll have to register, and then you can write the examination.
Okay. Then it's the next process. خب دوستان میگن که به خاطر راجستریشن که شما امتحان USMLE را بتین، باید اول خود چک کنین نام پانتونتون که راجستر است، یعنی بعد از اون میگه شما میین در سایت ECFMG که شما درخواست راجستریشن تان میکنین. بعد زو پانتونتان ضرورت است که یک لیتر یا یک ورق رسمی روان کنه برای این سایت که اینا مسئله ماستن. بعد از او شما میتونین که پروسس بعدی تان که با پاسپورتتان البته گفتن در اول ضرورت است برای راجستریشن ابتدایی، بعد زو لیتر که پانتون شما روان کردن، بعد از او شما کاری که میکنین ایست که همین تمام ترانسکریپت و معلومات های دیگه تانم در سایت اپلود میکنین. Okay, thank you. We previously talked about what are the steps for applying USMLE. That was
we spoke about it.
Yeah, we spoke about it, and we also did how to apply for it. Now we are going to ask the important question, like how to get prepared for this exam.
Okay, so how to get prepared for this exam? This is a very tricky question, right? And there are lots of myths about USMLE that is revolving in the market. That it is very difficult. It's very difficult to get into surgery, or it's very expensive as well. So there are lots of myths that are rotating in the market. Now, the best idea is to start with the preparation, but you'll have to change your learning methodology. Because if you're doing MBBS, in Asia, the students have the tendency of memorizing the topics, right, rather than understanding.
Yes, yes.
And that is the biggest negative point if you're preparing yourself for USMLE, because USMLE is all about understanding, right? So you'll have to get into the depth of every concept. You can't just memorize and get into USMLE, first thing. So you'll have to change your method. If you think that, okay, you'll be able to prepare on your own, yes, you'll be able to prepare on your own, but you need a guidance so that you can, it can help you in changing your learning method, right? So for example, any of the student who is into the third year, right? They have just completed the second year and they have just started third year. So please, it's the right time for you to start with your USMLE step on preparation, because third year is not that hectic. Fourth year is going to be very crucial, right? Third year is not that hectic. So third year is the time when you can easily prepare and write your USMLE examination. Another reason behind how I am suggesting you for third year is that the concepts of first year and second year are still fresh in your mind. So there are chances that you'll be able to do excellent in your examination. First thing. Second thing, for USMLE step 2, similarly, internship is the best time for you to write your USMLE step 2. Okay. Now, if you're in your internship and you have not thought about USMLE as of now, like so far, and you have just decided now, I want to go ahead with USMLE, then they might get some suggestion from their friends that, hey, you're too late, or age is the factor. So this is never the case. You can easily start your USMLE preparation and apply for residency, provided the gap that you have between your graduation year and the year you are applying for MASH, you should have a justification for it. For example, let's say if you work somewhere, very good. Even if you did not work somewhere, then please clear your USMLE steps without much gap, so that you'll be able to justify. Right. So if you talk about how to prepare for it, yes, please go ahead with the materials. Don't stick to the self-study that, okay, I'll just get some textbooks and I'll prepare on my own. It is risky. I'm not saying it's impossible, but it is risky.
Yes. Because
Right?
it will take time and maybe you will not get the result you want.
Exactly.
Yes. خب ما پرسان شانه کردیم که چطور میشه به امتحان آمادگی بگیریم. گفتن بهترین گزینه همی است که شما در سالهای سوم و چهارمتان شروع بکنین با آمادگی به خاطر از امتحان، و بهترین موضوعی را که اینا اشتراک کردن نیست که باید تحت نظر یک کس باشه که یک اکادمی باشه یا یک جای باشه که اونا همی آموزش ها را بتن و شما مطابق به دستورالعملای اونا عملی کنین و پیش برین و آمادگی بگیرین. میگن ناممکن نیست که خودتان با درس خواندن خودتانم موفق شوین، ولی بهتر است که تحت نظر یک کس باشه که اکسپرت باشه. Okay, so the next question is like some of our friends asked that some recommendation letters are also needed when we want to
exactly
that kindly given for
okay. So this is a very important topic which I love to discuss. Okay, so when you aim for USMLE, right, your ultimate aim is to get into residency. Irrespective, I'll not talk about which specialty you want to get into, because lots of students want to get into medicine or like internal medicine, family medicine, psychiatry, pediatrics, and some of them even aim about surgery or domain. So domain and surgery are very competitive over there. Okay. So let's say if you are applying for surgery or even for internal medicine, you have along with you have lots of other candidates across the globe who have applied for it, right? So it's your CV that makes it your application different. So in terms of USMLE, what matters the most, first of all, is your your scores. Step one is pass and fail. Now step 2 CK is going to be a deciding factor. So your step score, your CV, and then how are you portraying yourself in front of the interviewer. So there are three things that matters the most. So steps isn't completely your hand. You can prepare, you can get some materials, you can prepare, and you can get the score. Now, what about your CV? So if you want to get into add value to CV, we recommend you to have first of all letter of recommendation. Now, letter of recommendation, how it can be gained. There are three ways of getting the letter of recommendation. First, going for electives. That means if you are in your internship, you can go to United States. You can get complete hands-on experience in in your desired specialization. come back with a letter of recommendation. Now, no one can guarantee you letter of recommendation, right? But if you are behaving well, if you're a bright student, you will get letter of recommendation. Let's say if you are a bright student, you went in, you had a very good argument with your preceptor, he's not going to give you letter of recommendation, right?
Yes.
So it's completely on your behavior that you can get letter of recommendation or not, your behavior, your attitude and everything. So first is you can go for electives during your internship, gain complete hands-on experience, get the letter of recommendation. Now, if you are a graduate, you can still go for hands-on experience. We'll call it as externship. You'll go there, you'll come back with letter of recommendation if you did well. Third is the observership. That you can go to a hospital over there, you just need to shadow a doctor. That's it. You won't be allowed to talk to the patient, you won't be allowed to touch the patient. Right? And you can get the observership letter of recommendation. So if you'll ask me, I think observership letter of recommendation does not it does not hold much value. Being a non-medical guy, anyone can do observership. You just need to shadow a doctor. So if you really want to add value to your CV, I'll recommend you to go for complete hands-on experience. Okay, please try. Now, even hands-on experience are of two types: inpatient and outpatient. Inpatient is that you're going to a hospital and you are assisting a preceptor, and you'll go on round and you'll end up seeing maybe 100 patients in a day, right? Second is outpatient, in which you are just going to a private clinic and you are attending you are attending 4 patients in morning, 4 patients are in evening, right? So that's also what we have. But we recommend we always recommend to have inpatient letter of recommendation, because you also learn lots of things.
Yes, yes. خب درباره از اینکه بعض دوستا پرسان کرده بودن که با بعض ورقای ریکامندیشن هم ضرورت است به خاطر اپلای کردن به خاطر یو اس ملی. خب بهتر از اینا گفتن که ریکامندیشنتان قسم از پیش دکترها باشه که شما هندون ترینینگ شما خودتان عملا و کار مریضا رو شما نزدیک خودتان دیده باشین و بعد از او در پولی از او بر شما دکتر ریکمندتان کنه. به این قسم هم شما خودتان یاد می داشته باشین و هم دکتر کارشان آسان میشن. Okay, the next question: how many times a person can give this exam? Like,
okay, so how many times a person can give this examination? So if you're repeating it more than 2 times, it is going to be a big negative mark on your CV. So you attempted it once. Let's say if you failed, unfortunately, you can again reapply after 6 months. Even if you fail, you can again reapply. But even when if you have failed, I'll recommend you, please do not try USMLE. Because it is going to be a big negative mark on your CV. It will be very difficult for you to get into residency after that. Okay. So if you talk about how many times, yes, you can apply. I mean, 3 to 4 times is what you can reapply. But if you'll ask me, I'll recommend you mostly 3, not more than that.
3 or 4. Okay. خب من سوال کردم که چند بار شما حق دارین که امتحان بتین. میگن شما 3 بار حق دارین. بعد از 3 بار اگر شما اپلای میکنین و ناکام بانین، باز براتون منشن میکنه که بهتر از شما امتحان ندین، به خاطر که سر رزیدنسی تون باز تاثیر منفی میکنه. Okay, thank you so much. Thank you so much for answering all the questions with very good detail.
Most welcome, Dr.
Kindly share information of your academy also with us, with the students, if you're having any exact website or any contact number that you want them to get contact with you. You can kindly share your screen and give us the information about that also, and it will be easy for them to directly get in touch with you.
Sure. So as I told you, like in the initial part of the conversation, that what we are offering is we are offering self-study material to all our students. We are even offering one-on-one online tutoring to our students. So I am from SST Overseas. We are located in Noida, and we are the India Desk of Medical School Companion. This is our website. So you can see that for step 1, what we have. So we have a 8 weeks preparation program also available, and then we have one-on-one tutoring. We have this one, like self-study material. These things are available. These are faculties: Dr. Mary Rubush, Dr. Philip Tisdall, Dr. Jack Wilson that we talked about. Same we have for step 2 CK. And we also help our students in getting letter of recommendation, that means clinical rotation. We have tied with 100 plus hospitals across the United States where we send our students for complete hands-on experience. Plus, we also help them with visa.
Okay.
Right. So let's say in case the visa gets rejected, we even refund the complete amount, deducting some percentage as a admin charges. We refund the complete amount, and some percentage as in to elaborate to talk appropriate. We deduct 10,000 in INR to as an admin charge and refund the remaining amount.
Okay. Kindly repeat the amount you were saying that this amount you're charging for, like preparation of step 1, step 2, step 3.
Okay, I'll come into it. So what we are charging for step 1. So what we have. Okay, before I go ahead with that, let me just show something to you that what we are offering to the students. So this is our portal where you'll be getting the access of, and you'll be like preparing. Plus, we also have an application available. So even if you don't want to get into it on the laptop and prepare, you can easily get into like study using your mobile app. So this is what my login credential is about this about the like a program. You can go on MSc courses. And you can see these are the kind of videos that's available, right? So it's not that we have segregated as a anatomy 1 lecture or a pharmac 1 lecture or a physiology 1 lecture. We have divided it topic wise for the better understanding of the student. Right, so we can see cardiovascular system, we have 19 lessons. Then central nervous system, we have 11 lessons. Endocrine, we have 12 lessons. GI tract, hematology, female reproductive system. So that's how it is. Okay. And we charge 85,000 rupees for the step 1 preparation, in which includes 250 plus hours of pre-recorded lectures, study materials in soft copy, question bank, plus guidance in ECFMD registration, your like study plan, your residency timeline, and everything.
Okay.
Right. And Dr. Jalal, if anyone is enrolling through you or through your channel, so what we can do is we can offer them step 2 CK for free along with step 1 in the same price.
Okay. Thank you so much. Thank you. خب دوستان عزیز معلومات دادن در مورد اکادمی خودشان که SST Overseas اکادمیشان است که چه قسم میتونن شما میتونین با معلومات ها و پروگرام هایی که اینا برای امتحان به خاطر پرپریشن اینا استفاده میکنن برای ما شما نشان دادن قدم به قدم و هر کورسشان کدام دیتیلز ها را در خود داره، کدام موضوعات اینا بحث میکنن و به خاطر پرپریشن استفاده میکنن. در کل تمام بخشا را اینا بالایش کار میکنن. استپ 1 آمادگی مکمل به 85,000 و در پالوش اینا برای کسایی که از طریق ما معرفی شوند برشان استپ 2 سیکی را به شکل رایگان آموزش میدن. Thank you so much. Thank you.
And so Dr. Jalal, and yes, to add more into it, right, you can even like join the student interest group over here. You can post your questions, you can interact with your club, with your study mates across the globe. You can even interact with the faculties and get your doubts cleared during the self-study.
Okay. و شما میتونین از این قسمت داخل سایتشان وبسایتشان شده و میتونین همراه مسئولین خارجی و مسئولینی که در هندوستان به خاطر آمادگی گرفتن کار میکنن، حتی همراه استادایی که اینا دارن، میتونین شما خودتون به شکل مستقیم و دایرکت در کانتکت شین. And as a specific contact number if they want to get
look, contact number getting is a little difficult, but yes, you can chat with these faculties or the tutors and get your doubts cleared.
Okay, okay. There is numbers in the website also. There's a button of
okay, this is my number. You can call me anytime. This is our email ID. Okay, just to give you more update about our website, if the student wants to see that what kind of lecture we provide or what kind of recording it is, they can go on our event section and you can see that like this is the webinar done by Dr. Philip Pascal, in which he talked about clinical physiology. This is the webinar by Dr. Mary Rubush, in which she talked about immune response, right? Now, chest pain, Dr. Philip Pascal talked about, and this is again my webinar in which I talked about Usmle, the recent changes and everything. Also, if you want to see that, okay, you have done with your MBBS and you're confused, hey, like, shall I go for Usmle or not? Is it difficult? Will I be able to crack it or not? In that case, you can come on my website under the home page. Yeah. Yeah. You can come on my website under the home page, and then you can just click here for free mock test. It contains 50 questions, and you will get the answer then and there once you complete the mock test.
Okay.
It is absolutely free of cost.
اوکی. به خاطر از اینکه میگن بعضی کسا کانفیوز میباشه که آیا ما میتونم نمیتونم، مشکل اساسان است، باز اینا یک ماک تست دارن، یک تست رایگان، به خاطر کسی که یعنی میخواه توانای خود حدس بزنه که بچی اندازه دانشم است و آیا ما میتونم یا نمیتونم. میشه یک تست رایگان است. این تست یک بار کلیک میکنن و تست امتحان سپری میکنن، باز میتونن که ظرفیت خود حدس بزنن که آیا میتونن دیگه امتحان پیش برن یا نرن. اینا گزینه هستن که اینا پیشنهاد میکنن.
And in case you guys have any question, you can easily click on WhatsApp option and you can easily chat with us anytime, 24/7. And by the way, this is our contact number, 9654712887. Email ID is info@sstoverseas.com. Our office is in T2 Sector 1, Block C, Noida. It's hardly 5 minutes walking from Noida Sector 15 metro station.
Okay. و کسایی که علاقه‌مندی دارن به خاطر ارتباط مستقیم همراهشان داخل وبسایت شدن، میتونن همراه بالای گزینه واتساپ هم کلیک کنن و هم میتونن اونجا شمارهشان ذکر است و ایمیل آدرسشان همچنان ذکر است. میتونن خودتان بدون کدام مشکل مستقیما همراه خود از اینا در تماس شوین و سوالاتی که اگر در ذهنتان باقی مانده باشه میتونین مستقیم همراهشان در میان بانین. هدف کلی ما همی است که بتانیم محصلین طبی افغان با اینا در ارتباط بسازیم که بتانن خودشان مستقیم با محصلین هندی، با کورس‌های هندی، با پروگرام‌های هندی در تماس شوند و بتانن که سطح ظرفیت دانش خود بالا ببرن تا بتانیم در ارتقای دانش محصلین افغان و دسترسیشان به معلومات بیشتر و بهتر. هدف ما می است که کمکشان کنیم. Thank you so much. Thank you for being with us. Really appreciate it. Thank you so much.
Thank you so much for having me, Dr. Jalal, on this platform. Thank you so much. And again, I'll wait for the students' queries on my call or my WhatsApp.
Yeah, they will come in contact with you directly. Thank you so much.
Great. Thank you so much, Dr. Jalal. You have a wonderful evening.
Thank you.
Thanks. Bye-bye.